The Cuban Ministry of Foreign Affairs released a statement stressing that the COVID-19 pandemic shows the need to cooperate despite political differences. WHO Director General Tedros Adhanom Ghebreyesus has responded to Donald Trump's halting of US funding to the agency in the midst of the novel coronavirus pandemic. The African continent has surpassed 17,200 confirmed cases of the novel coronavirus, according to the African Union. From the headquarters of Telesur English in Havana, Cuba, this is From the South. I'm Katrina Goss. The Cuban Ministry of Foreign Affairs released a statement stressing that the COVID-19 pandemic shows the need to cooperate despite political differences. The statement notes that the current crisis goes well beyond the scope of health, causing unquestionable damages to the world economy, production, trade and employment. The Foreign Ministry emphasises that the virus does not discriminate or distinguish the rich from the poor, but it impacts the most vulnerable hardest, especially where neoliberal policies and social spending cuts have limited public services. The statement concludes by sharing and providing valuable and reliable information and acting together, the propagation of the virus will be halted in a faster and more cost-effective manner. The Cuban Medical Brigade sent to support the fight against the coronavirus in Antigua and Barbuda has completed its quarantine and is ready to get to work. The initiative is part of the international medical cooperation promoted by the Cuban government in the midst of the pandemic. In addition to the thousands of Cuban medical personnel offering their services in many countries across the world, a total of 21 brigades of specialists have been sent to 20 nations to support the efforts to combat COVID-19, including Italy, Andorra and several Caribbean nations. Heads of government of the Caribbean community agreed joint measures to fight the COVID-19 pandemic during an emergency meeting held on Wednesday via video conference. The Caribbean leaders also agreed on a collective approach to international financial institutions to access assistance and called for the lifting of sanctions on Cuba and Venezuela on humanitarian grounds. They also condemned the US move to withhold funding for the World Health Organization at a time when joint efforts are required to combat the pandemic. The leaders agreed to meet again within 2 weeks to address other proposals such as a common health policy and protocols for the reopening of borders, as well as food security. The Caribbean community is made up of 15 full members and 5 associate members. President of Nicaragua, Daniel Ortega, addressed the nation on Wednesday evening regarding the Sandinista government's response to the COVID-19 pandemic.
We have intensive care units active all over, with highly trained doctors. The state's medicine reserves are fully stocked, and there are some medicines that only the state has access to, like the Cuban interferon. We have the capacity to help our population in the same rhythm as the virus presents itself. We are not rushing ahead, because that would have been detrimental. We're doing this in an orderly fashion, implementing a number of measures and following international guidelines, but applying them in the same manner that suits our reality.
Peru continues to have the second highest number of confirmed coronavirus cases in the Latin American region, at more than 12,000, while its death toll has reached 274. In third place in the region is Chile, where the number of cases has surpassed 8,105 people have lost their lives. Meanwhile, in Ecuador, government workers are going door to door in the city of Guayaquil to deliver food and offer medical care and advice to residents in a newly launched program to fight the spread of the coronavirus in the city, the epicenter of the epidemic in the country. Ecuador has officially reported over 8,000 COVID-19 cases and more than 400 deaths. And in Colombia, a temporary hospital is being built in the Conferias Convention Center in the capital, Bogotá, that will initially have 2,000 beds for patients who are not infected with COVID-19. The move is intended to allow Bogotá's regular hospitals and clinics to care for coronavirus patients. The country has reported over 3,000 confirmed COVID-19 cases and 131 fatalities. The Supreme Federal Court of Brazil has dealt a blow to President Jair Bolsonaro after ruling that the country's states and municipalities have the autonomy to adopt decisions regarding the handling of the COVID-19 pandemic. The 9 judges of the Brazilian Supreme Court unanimously ruled that mayors and governors have the power to adopt measures regarding public health and therefore can impose quarantines on the population to combat the novel coronavirus. In the hearing undertaken via video conference, the judges analysed an appeal against the provisional measure issued by the Brazilian government to concentrate decision-making power over measures such as isolation, quarantine and the restriction of movement. Judge Guilherme Mendes stressed that President Bolsonaro has the power to remove the Minister of Health, but does not have the power to exercise a genocidal public policy, in reference to the President's plans to lift lockdown measures nationwide. And Brazil is the hardest hit nation by the coronavirus in the Latin American region, with over 29,000 cases and more than 1,700 fatalities. Our correspondent Brian Meir brings us the latest on the situation there.
Brazil's Fiocruz Public Health and Scientific Research Institution just released a report saying that 70% of the country's public hospital ICU unit beds are occupied. And it says that this is mainly because of the coronavirus crisis. Here in São Paulo, where Hospital Clínicas, the largest hospital in the nation, is operating with 77% of its ICU beds occupied, public health officials initially predicted a collapse of the system in mid-April. Now that date has been pushed back to the last week of May. The isolation orders issued by Governor João Doria and Mayor Bruno Covas seem to be working, despite the fact that not everybody is paying attention to them. A recent study based on cell phone data showed that only 47% of the population was obeying quarantine orders. After the state government made a push last week, this number's gone up to 59%, but the goal for the curve to be fully flattened is that 70% of the state's population would pay attention and obey the lockdown orders. Meanwhile, last night the National Health Ministry announced that another 204 people have died because of coronavirus.
Volunteers in Costa Rica have organised to distribute fruits and vegetables to residents of the town of Paraíso, where local farmers have donated the crops that they couldn't export due to the coronavirus pandemic.
We came to receive the aid for the families affected by the COVID-19, families who have become unemployed or whose working hours have been reduced.
We knew that there would be a lot of perishable fruit and vegetables left over, which are mainly exported to Europe and the United States. So we have decided to launch a solidarity campaign to help all those vulnerable families who are having a hard time at the moment.
More stories coming up after this very short break, so don't go away. Welcome back to From the South. The Director General of the World Health Organization, Tedros Adhanom Ghebreyesus, has responded to Donald Trump's halting of US funding in the midst of the novel coronavirus pandemic.
We regret the decision of the President of the United States to order a halt in funding to the World Health Organization. With support from the people and government of the United States, WHO works to improve the health of many of the world's poorest and most vulnerable people.
Dr. Hans Kluge, the World Health Organization's European Regional Director, held the show of support for the UN Health Agency after US President Donald Trump announced a halt to funding. The WHO official also stressed that the European region is facing about half of the global COVID-19 infections.
Make no mistake, despite the spring weather, we remain in the midst of a storm. Several countries are yet to feel its full impact, while others are experiencing a dip as numbers of new cases of COVID-19 are falling. It is imperative that we do not let down our guard. If countries do not have adequate all of society and all of government preparedness and response strategies in place, if your health workforce is not trained and equipped and protected, if your citizens are not informed and empowered with evidence-based information, then the pandemic will sweep through your communities, businesses and health systems.
President Donald Trump is threatening to invoke a never-before-used authority to adjourn Congress and push through dozens of executive branch nominees in the midst of the coronavirus crisis. The move would almost certainly spark a legal battle between the White House and Congress over the limits of presidential power. Trump said there were 129 nominees stuck in the Senate because of partisan obstruction, and threatened to formally adjourn Congress and install his nominees without a vote. The Constitution allows a president to fill temporary appointments during a recess without congressional approval. But lawmakers in both parties have sought to thwart certain appointments over the last decade by never technically shutting down the Senate.
If the House will not agree to that adjournment, I will exercise my constitutional authority to adjourn both chambers of Congress. The current practice of leaving town while conducting phony pro forma sessions is a dereliction of duty that the American people cannot afford during this crisis. It is a scam what they do. Perhaps it's never done before. It's never been done before. Nobody's even sure if it has, but we're going to do it. We need these people here. We need people for this crisis, and we don't want to play any more political games. It was early on. They were angry that we...
President of the European Commission, Ursula von der Leyen, recognised on Thursday that the EU owes Italy an apology for the lack of response at the start of the COVID-19 outbreak.
Yes, it is true that no one was really ready for this. It is also true that too many were not there on time when Italy needed a helping hand at the very beginning. And yes, for that, it is right that Europe as a whole offers a heartfelt apology. But saying sorry only counts for something if it changes behavior.
As COVID-19 testing increases across Spain, it is expected that the number of cases will rise as asymptomatic carriers are also identified. However, the hopes are that the process will help detect more potential patients.
Even as the evolution and trend continue to stabilize or even lessen, we have to still regret 551 new deceased people because of coronavirus in Spanish regions yesterday. Today we have a total of 5,183 new cases. In total, we have identified since the beginning of the epidemic 182,816 cases in Spain.
Russia's two largest cities of Moscow and St. Petersburg have become ghost towns as local authorities enact measures to stop the spread of the novel coronavirus. Moscow on Wednesday launched a system of mandatory digital lockdown passes for residents seeking to travel through the city by car or public transport. Meanwhile, in St. Petersburg, which has about 16 times less coronavirus cases than Moscow, the measures have been largely entailed voluntary self-isolation recommendations, but the vast majority of residents have opted to stay home. Russia has reported almost 28,000 cases of the novel coronavirus and 232 fatalities. China has successfully contained the COVID-19 outbreak, but is now struggling with a new wave of cases, mainly consisting of Chinese nationals returning to the country from abroad. On Thursday, China reported 34 imported cases from overseas, as well as 12 domestic cases, following the same pattern of recent days. Meanwhile, workers in protective suits inspect passengers returning from Wuhan at Beijing train station as the Chinese capital tries to counter the threat of a second wave of coronavirus infections from other regions of the country. Beijing authorities have imposed a strict 14-day quarantine on people arriving from other parts of China, regardless of whether they have tested negative for COVID-19, a measure not yet adopted in other cities. And we're taking one final break now, but stay with us for more. Welcome back to From the South. The African continent has surpassed 17,200 confirmed cases of the novel coronavirus, according to the African Union. According to the regional organisation, over 3,500 patients have recovered from the virus, while the death toll has risen to 910. Most patients are located in the northern region of the continent, while Central Africa remains the least affected area. The African Union is made up of 55 states, and COVID-19 cases have been reported in 52 of them. Only 3 member states, Lesotho, Western Sahara and Comoros, have not registered any cases of the coronavirus. And a team of Chinese medical experts left for Burkina Faso on Thursday to aid the African state in the fight against the COVID-19 pandemic. Invited by the government of Burkina Faso, the 12-member team departed in the early morning from North China's Tianjin municipality. Experts of the city's Disease Control and Prevention Center are also part of the medical team. Doctors across South Africa are bracing for a potential surge in critically ill patients as the number of COVID-19 cases continues to rise. More than 2,500 cases have been detected, the highest number in Africa, including 34 fatalities. Meanwhile, a team of doctors from Johannesburg's Charlotte Maxey Public Hospital has showcased a newly designed coronavirus protection device for healthcare workers. The Intubox is the brainchild of 4 local doctors, inspired by a similar aerosol box used in Taiwan for sedated and intubated patients, and will have an open-source patent to allow for its global manufacture.
This box will create a seal around the patient so that whatever further procedures are needed will happen inside the box. For example, if you have to suction down the tube, you have to disconnect the patient from the ventilator, and if they cough, that's a very dangerous thing for staff. So by ensuring that all of that occurs inside the box, you're actually isolating the patient in a container. The virus cannot spread to your other patients, it cannot spread to your staff, so everybody is more protected than they would usually be. But I think all healthcare workers on the front line have gotten used to the idea that they are at risk. They are likely to still get infected despite everything that we're doing. And it's simply part of the job. I mean, healthcare workers have been going to Ebola regions for years. We treat drug-resistant TB here. We treat severely infective meningitis. This is not the first infective agent that we've had to cope with. And I think for a lot of us, this is simply adapt and move on.
India has now reported over 12,700 COVID-19 cases, with its states registering over 500 cases in the last 24 hours. 423 people have passed away in India since the beginning of the outbreak. Meanwhile, at least 1,500 people have recovered from the virus. Delhi and Tamil Nadu are among the most severely affected states. Over 650,000 COVID-19 rapid testing kits were dispatched from China to India on Thursday, and a further 2 million kits will be sent in the next 2 weeks. India has extended its nationwide lockdown to May 3rd in an effort to stem the spread of the disease. And meanwhile, the partial lockdown in the capital of Thailand, Bangkok, has eased the city's usual heavy traffic. Thailand reported 29 new coronavirus cases and 3 deaths on Thursday, bringing the total number of cases to over 2,600 and the death toll to 46. The country has also reported that more than 1,500 patients have recovered. A wide representation of Syrian civil society organisations continue to call for the lifting of the US sanctions against the country, particularly in the midst of the novel coronavirus pandemic. Intellectuals, artists, religious representatives and professionals of different sectors have joined the campaign, highlighting the imposed war and blockade of Syria. Father Elias Salawi, founder of the Al-Farah Choir, is among the leading voices of the campaign and has called for support from all Eastern churches to condemn the unilateral sanctions against his nation. And we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss, and thank you for watching.